today's video, and today's video is alveolar air equation. Also, you might know this as the oxygen tension equation. All right, so there's a couple ways that you might see this: the alveolar air equation or the oxygen tension formula, equation, whatnot. Really, what you're trying to do is unpack this thing called an AA gradient. You want to see alveolar versus arterial, and to get the alveolar, you need to do a little equation, and that's this equation that we have up here. All right. So before we do that, I told you the point of this is the AA gradient, right? It's the alveolar to arterial to see if there's anything going on there. But like I said, there's a formula to get the big A. Now, let's unpack this. The big A, that is, okay, alveolar, right? Alveoli. The little a is what? Arterial, okay? So we need to know that, arterial, and we get that from a blood gas. Okay, this one we need a calculation. This one we're going to get from our ABG. All right, and we have an example ABG here. And this is where we're going to take our numbers for today's video, right here. All right, and we have a lot of stuff here. Very quick video, but really it's for the AA gradient. That big A, that's what you're trying to get, right? This equation is equal to this big A right here, which we know that is alveolar, and the arterial is there. So we got to square that away before we get started here. All right, so let's get started. Alveolar air equation. First, you need the FiO2. Then you need the barometric pressure, and then you would subtract that from the water pressure, and then you would subtract this whole thing over here, which is the CO2 divided by the respiratory quotient. So let's just get right to it. Here's our ABG, here's our FiO2, here's our respiratory quotient, which I'm going to tell you, remember that as normal. We'll get down to it. So let's just start putting in our numbers here. FiO2, we know we have 21%, 0.21 is what we're looking at, right? Our barometric pressure, guys, at sea level is 760. They're not going to change you up on this on the text or board exams, but if they do, they will give you this number, and you just got to remember. That's why I always like formulas, and you plug and play. This one never changes. This is your water pressure, right? It's 47. Okay, you subtract that. So we'll go over this. And then your CO2 is the next. Where do we get our CO2? From our blood gas, your CO2, right? Arterial CO2. Right here we got 40. That's absolute normal. Okay, we're going to divide that by our respiratory quotient, which is 0.8, and that's normal. Memorize that, 0.8 respiratory quotient. Okay. All right. Now we can simplify this, right? And we can keep going down. Not that good at math, right? So what do? We bring it up. So in a formula like this, you always want to solve the parentheses first. So 760, do you see where I'm getting that? Okay, 760 minus 47 should be 713. This doesn't change, guys. But I don't just want you to remember 17 and plug that in every time, because they could throw you off of making the 748 minus 47, right? So you can't just stick with numbers, because they're not always at sea level, all right? All right, so then we're going to take it, we're going to do this one. So what did it say? We're going to do 40 divided by 0.8, and we get 50. All right, so now we bring this down, 0.21. Now that's a multiplication when you see this, right? So now we need to solve that first, multiplication first. So we go 21.21, 0.21, that's our FiO2. We're going to multiply that by 713, okay? And we get, and that is 150, guys, 149.70. Let's just make that 150. Now we know we need to keep going. All right, trusty calculator says 100, but let's just see what it says here, right? You guys got it, right? 150 minus 50. You get 100. And 100, guys, is good. That's normal, guys. 100. If you didn't realize, those were all normal values we just plugged in there. Normal, absolute normal, FiO2, respiratory quotient, normal gas. Okay? Normal gas. So now we got the big A. Our big A is right here. It's 100. So let's take that AA gradient, guys, and let's bring it over here. The big A minus little a. We're over here now, right? The big A, we just said, that's 100, right? And then we subtract that, and where do we get the little a? Arterial. Guys, that is O2. That is 90. Do you see that? 90. Right? We want arterial oxygen minus alveolar oxygen. 100 minus 90, and your AA gradient comes out to 10. Okay? Your answer is 10. Now, I put a little cheat sheet. Normal. This is normal. It will never be 0. You're going to have a slight variation of between about 5 to 10 on 21%. A slight variation with normal, 21%, 5 to 10. That is good. So our answer for our AA gradient is 10. Normal. Very good. All right, let's just say that we changed up these numbers and you got 25 to 65 on 100%. That's normal. Okay, and I'm going to go down with this on 100%, 25 to 65, and torr is equal to millimeters of mercury, guys. Okay, so these are the interchangeable. They're the same thing. Okay, so on 100%, that's normal. Now if you hit 66 to 300, that is a VQ mismatch. Ventilation to perfusion. The Q is perfusion. Ventilation to perfusion mismatch. If you're greater than 300, we're talking about this number right here, guys. If you're greater than 300, we are now saying this is a shunt or shunting. Something's going on. VQ mismatch to shunting. Here's what we're going to do, okay? And I'm going to show you, okay? I'm going to bring this up, and we're going to talk about this real quick. I know this is a calculation video, but we always give a little bit more. All right, hypoxemia, right? We know what this means, right? So you see that, the difference there. If it's normal, right, we can consider that to be altitude or hypoventilation, right? You see that? Okay, now it splits off and it says increased, right? And we're talking about AA gradient is increased. And then you see it drop down to FiO2 1.0, that's 100%, okay? So we know we have a shunt and it's increased. It's greater than, 100% shows it right there. Now we're looking, if it's 66 to 300, VQ mismatch. If it's greater than 300, we have shunting. Here's what this flow chart shows you. And here's the secret. How can you quickly, and yes, you can do this quickly, assess if this is a VQ or shunt, right? Well, we get a number, but if they respond to FiO2, more than a number right here, this is a number given to you, but in real clinical practice, you would give a high FiO2, a non-rebreather, right? And if they responded to that 100% FiO2, then you know you're dealing with a VQ mismatch. You see that? You don't see the little arrow, but if they respond, that's a up arrow responsive, that's a VQ mismatch. If they do not respond to FiO2, that is a shunt. Here's how we know that. A VQ mismatch, ventilation to perfusion, we give a high FiO2 and your SATs go up or you respond to it, we know there's nothing impeding that. That's something going on, but he responded. It's a VQ mismatch. Got to go a little bit into it. But shunting, if we give 100% FiO2 and they actually don't respond, or they go down, or they start to drop in saturations, then we know there might be fluid consolidations, things like that. How does FiO2 go through fluid or consolidation, guys? It won't. You can put all the FiO2 you want in the lungs, but it has to get through a barrier. That's shunting, right? So here's some causes, guys. We see the flow chart. If they respond, VQ. Unresponsive, shunt. Okay? All right. So now let's look. Here's some potential causes, guys. All right. I really want you just to focus on the bottom two, the VQ mismatch. You see how it says Elevated, yes. What are some? Mucus plugging, pulmonary embolism, right? You see that? COPD. You give high FiO2, they will respond. Okay? Check out the shunt. Elevated, but it doesn't respond to FiO2, and that is what? Atelectasis, atelectic lungs, the alveolar collapse, right? How do you get FiO2 in there? You got to pop that open, but the root of it is it's closed, right? It's something closed it. ARDS, restrictive disorder, guys. It's hard to oxygenate. They're so tight, you got to push air in there. That is a restrictive oxygenation issue, okay? Shunting, VQ mismatch. Responds to FiO2, VQ mismatch. Doesn't respond to shunt. And guys, that really is it. That is this air equation video and really your AA gradient, right? So listen, I need you guys to give me some responses, give some comments, right? Let us know what videos work for you, right? And with this video, keep practicing with these videos. I gave you normal values here, but that's not all the time. That's not real life what the patient's going to represent, right? Plug in some numbers that are off, right? Keep this one the same, keep the RQ, but you can change the CO2, the FiO2, play around with it until you dial that in. Get some numbers that look, you know, that are falling in there. Interpretation right here. Know your normal, 5 to 10. This right here. Practice, guys. Practice, practice, practice. That's why we do these videos. And again, subscribe to the videos. We have new videos coming out every week, and maybe multiple videos that you could fall behind or you could actually catch up. And also, like, comment. And the reason why I'm saying that is because it gives us real-time feedback of what you guys need, want to see, maybe touch up on, get more proficient in. It helps us understand what you guys need. So again, thank you for RT World and making this happen, guys. We're going to keep coming out with these videos. Hopefully they're very productive for you guys, or you know, very, you get some stuff out of this, fruits, right? You really build upon this, right? So again, thank you. My name is Mr. Cates, and we look forward to seeing you in the next video.